Beloved students, today we are starting with the degenerating diseases, and the first one is Parkinson disease. We will cover all the rest diseases in our next section. Today we are discussing Parkinson disease, very important and high yield for the exams. Remember, in 4 to 5 minutes we will cover the whole Parkinson disease and you will be able to answer each and every type of question. So let's start Parkinson disease. Parkinson disease, it is also known as paralysis agitans. Agitans or paralysis agitans. Paralysis agitans. It is the second name of Parkinson disease. But what is Parkinsonism? Parkinsonism collection of syndrome. Parkinsonism is a syndrome, collection of syndrome due to damage of dopaminergic neuron within basal ganglia. When dopaminergic neurons they are damaged within the basal ganglia, it is called Parkinsonism. So what is the cause of Parkinsonism? The most common cause of Parkinsonism is Parkinson disease, and the second one is Parkinson syndrome. So behind or beyond these are secondary to the damage of the basal ganglia caused by means, except dopaminergic neuron damage, there are many other causes to develop Parkinsonism. The first one is past encephalitic pandemic influenza infection broke in 1915 to 1918. So if it is present in the genetics, maybe it is a cause of Parkinsonism. The second one is dopamine antagonist. The drugs against dopamine means to stop the working or to block the receptors of dopamine antagonists, they are the second cause. The third one is pesticides like MPTP. The fourth one is repeated trauma. You have seen the trauma in the boxers, they may lead to Parkinsonism. Chronic carbon monoxide poisoning and Wilson disease. So beyond the damage of the dopaminergic neurons, these six are also the causes of Parkinsonism. So remember two things, that this is very important. This is very important. Pesticides, they increase the risk. Caffeine and tobacco, they decrease the risk. So caffeine and tobacco have a single advantage, and that advantage is that they decrease the risk of Parkinson disease. So what is etiopathogenesis? Is it hereditary or sporadic? It is both sporadic and hereditary. And hereditary, you can say it autosomal dominant and autosomal recessive. Autosomal dominant is due to gene mutation in the protein alpha synuclein, leucine rich repeat kinase, and glucocerebrosidase. But remember, this glucocerebrosidase is also associated with Gaucher disease, very important and high yield for the exam. The autosomal recessive, due to mitochondrial dysfunction, there is mutation in DJ1, Parkin, and PINK1. If these three genes are affected, it can lead to Parkinson disease. Now let's discuss the pathogenesis. Pathogenesis include mutation of these gene or mitochondrial dysfunction or proteasomal defect. These three are the pathogenesis, and the pathogenesis, mutation of the genes, mitochondrial dysfunction, and proteasomal defect, it leads to increase in alpha synuclein protein. And when alpha synuclein protein is increased, there is a risk of more misfolding of the protein. This is a synuclein function, misfolding of the protein, and it leads to damage, the dopaminergic neuronal damage in substantia nigra and lucus ceruleus. This is very important. Damage in the substantia nigra and lucus ceruleus of dopaminergic neurons. The clinical features, if you are in the clinic and you will observe that the patient will present with more than 50 years, and you can remember easily the clinical features by the TRAP. T for tremors. Tremors pill rolling or resting tremors. Resting tremors means when he is at rest, he will do like that. Rigidity, cogwheel rigidity. And the third one is akinesia or bradykinesia, slow movement. And postural instability, also known as shuffling gait, also known as fascinating gait. And he will also have a mask like face, means when you say something, he will not laugh or anything, means expressionless face, expression less face. And dopamine inhibit, when there is dopamine presence, it inhibit sebaceous gland. But when dopamine is decreased, sebaceous gland working is increased. when de- when sebaceous gland working is increased, it leads to increased sebum, and increased sebum leads to what? Wax like face. So the one having Parkinson disease having wax like face. Got the point? Okay, so on gross you will see what? Substantia nigra black color due to dopamine. Normally you will see, I will provide these in PDF in the comment box. Normally it looking black because of the presence of dopamine, but when there is decrease in the dopamine, the black color is changed to pallor. So pallor of substantia nigra correlates the severity. And if you are a pathologist, how will you examine? Microscopic examination, you will see what? You will see eosinophilic inclusion with halo. Halo means another membrane surround it. So eosinophilic inclusion, there will be a body presence and it will be surrounded by another membrane, and this body is called Levy body, and this is composed of alpha synuclein. You can see these are the Levy body. So if being a pathologist, you will examine on this alpha Levy body. Being a doctor present in the clinic, you will identified it through this tremor, rigidity, akinesia, postural instability, and he will having a wax like face and expression less face. These you can see, there is a dark color, it is normal, and there is no dark color, it means it is a pallor, and this one is suspected to have what? Parkinson disease. Have a good day.